Yeah, hi, we have our patient Lukas here today. He had a hair transplant last year in August, and he came to me because he's not happy with the result. And maybe you can tell us why you're not happy with the result?
Yes, right after, or like 2 weeks after the hair transplantation, I already saw that when the grafts which were transplanted were growing, that the density between the grafts was like nothing close to my natural hair. The direction of the growing of the hair was not naturally, and especially also that the density was not really homogeneous over the head. Like you had areas where the grafts were close to transplanted, in other areas which were like more space was between the grafts, and all that kind of led to the problem that I wasn't happy really with the first transplantation, and that was also the reason why I consulted Dr. Otberg.
Yeah, so now I can maybe show you what I don't like about this transplant. First of all, if you comb the hair back here, there's a big gap. So obviously nothing was transplanted here, and if you do a hair transplant of the frontal hairline, you always need to have a little bit of a transition zone. Because also, even though you're taking dutasteride and minoxidil, that keeps the hair that you have, eventually if somebody doesn't want to take any medication, or if the medication doesn't work as well, then then eventually you could develop a gap after a while. And then the other thing that I don't like about the hair transplant is the hairline, the appearance of the hairline. It looks really very straight, plus there are multigrafts in the frontal hairline, especially here in the corners. And we don't have multigrafts in the frontal hairline naturally. So once you plant multigrafts in the corners here or in the front, it looks really unnatural. The second thing is the density. Well, density, I must admit, you can never have the density you used to have with a hair transplant. It's about 50% of the density that you had before. But if you look at the density here, it's not close to 50%. So what we want to do today is we want to surgically remove all these multigrafts that look unnatural, where the direction is probably also a little bit off. And then in 2 weeks, we will plan a bigger session where we then transplant smaller grafts, and we will soften out the hairline, and we will increase the density here. So now Lukas's hair is a little bit longer, so it may appear to the untrained eye that it's all okay, that the density is okay. But once we cut the hair a little bit shorter, we will see all these gaps. We'll cut the hair today for the surgery because it's easier for me to remove the grafts and then to redistribute them to the back. Okay, so now Lukas's hair is really short, and now you can see this really a little bit awkward pattern. The density really doesn't match the density of his pre-existing hair. You can see that there are multigrafts in the frontal hairline, that the hairline is really straight with no micro irregularities, and that also the direction is a little bit off here. So we now try to remove all these little multigrafts everywhere, all around this transplanted area. And then you see that the gap is left here, and there's no connection to the pre-existing hair. And this side is a little bit better, so somebody else planted on this side, but it's still, the density doesn't really match the pre-existing hair, and there are also multigrafts in the corners here and also in the frontal hairline.